Buenos dias, good morning, Ogden Surgical Medical. How is everybody feeling? Yes, all right. It's been a wonderful conference for me, and I'm really excited for today also. Came up really energized. This morning, our favorite, at least the favorite for many of us, is what's new in my specialty. We have four great presenters. Our first presenter will be a pre-recorded presentation or lecture. She's not available currently. I think she's in Portugal. But let me introduce her. Her name is Jeanlee Carver. She's local and somewhat of a legend here in northern Utah. Jeanlee Carver, her credentials include an MS, an APRN, a CPNP PC, an ANP BC, a SANE A, and a SANE P, and she is the CEO and clinical director of the Northern Utah Sexual Assault Forensic Examiners here for all of us in northern Utah. And her lecture on sexual assault was pre-recorded, but we're going to go ahead and start that now. Unfortunately, she won't be with us, so we won't be able to do question and answer. But we can go ahead and start.
Good morning. My name is Jeanlee Carver. I am an adult and pediatric acute care nurse practitioner, board certified in both specialties. I am the CEO and clinical director of the Northern Utah Sexual Assault Nurse Examiners. My practice historically has been in forensics, child abuse and neglect, where I practiced with Primary Children's Medical Center for 25 years at the Children's Justice Center in Ogden, Utah. I'm a founding partner of the Northern Utah Sexual Assault Forensic Examiners, which was established in 2005 when a group of nurses came together after realizing that we had no services in this community or in the surrounding counties for those who had been victims of assault. First of all, let me say that I have disclosed to the Ogden Surgical Medical Society all relevant financial relationships, of which there are none, and that I am receiving no monetary compensation for this presentation. So what exactly is sexual assault? It's defined as any form of forced or coerced sexual contact without the person's consent. So this can include many things: rape, incest, molestation, oral sex, harassment, lewdness, forcing someone to have their photo taken in an unclothed situation, or even touching in an elevator or on the bus. So rape is a specific form of sexual assault, and in Utah that's defined as sexual intercourse without the victim's consent. Now, rape's the only violent crime for which Utah's rate is higher than the national average, which is pretty sad. And this is nothing new. This has been this statistic for over 25 years. So do we as healthcare providers really care, really need to be concerned? Well, yes, because we may have patients who come to us for their initial seeking of help. So the FBI, their Uniform Crime Reporting database says the rates of rape are at 55.5 people per 100,000. The national average is 42.6 per 100,000 people, and Utah is ranked 9th out of 50 states for the number of sexual assaults or rapes per capita. So that means nearly 1 in 2 women in the United States and 1 in 4 to 5 men will experience some form of sexual violence victimization within their lives. Now, you have to keep in mind that sexual assault these statistics encompass both child abuse and rape of adolescents or adults. So, unfortunately, many of these people who are victims of sexual assault and violence in Utah are children, as we've just stated. And these kids are most likely victimized by a family member or someone who's living in the home. Females more likely to report than males. That's something that we won't get into. But the CDC, they say 1 in 4 women is sexually abused before the age of 18. In Utah, nearly 13% of the population reports being molested before the age of 18, and almost 80% report that this occurred before their 18th birthday, while 35% of those stated that they were molested before the age of 10. So more specifically, these statistics are pretty disturbing, and I think we have to admit as healthcare providers that we are going to come into contact with someone who's been victimized sexually. Every 68 seconds, an American is sexually assaulted, and every 9 minutes, that victim is a child. When we look at reporting statistics, we know that only about 12% of women ever report a sexual assault to law enforcement, and only about the same number ever seek medical care. Some people believe that these women or men are making this all up. Didn't really happen. But we know that that's not the case. Only 2 to 10% of all sexual assault reports are found to be untrue. But we know that the problem is not reporting. And I've often thought to, myself, what would I do? Having been through the examination process with victims, the investigation with law enforcement, and the prosecution with attorneys, I think, do I want to go through that? Because it is not easy. Most sexual assaults are committed by male perpetrators who the female victim knows. So it's a boyfriend, it's an acquaintance, it's a neighbor, it's someone they attend school with, it's someone that they go to church with. So rape by a stranger is very unusual, and weapons are rarely used. However, physical injury occurs over 25% of the time. We have to discuss vulnerable populations. I know that many of you have various practices and see people across the lifespan for many different reasons, but we have to look at the elderly and we have to consider other vulnerable populations. So only about 30% of people over the age of 65 report a sexual abuse. And 83% of older victims reside in institutional care centers. The rate of sexual assault among the elderly is much lower than young women, which you would expect. And about 27% of the sexual assault that happened occurred in the elder's own home. And 80% of that time, it was by someone who was taking care of them. Homeless teens and adults are at higher risk for sexual assault, and those women in racial ethnic minority groups also experience a higher burden of sexual violence. Then we have to look at the people who are disabled, and they're the perfect victims. Whether this patient is intellectually or physically disabled or challenged, they make the perfect victim. So what are some of these myths I mentioned? Sexual assault is an act of lust and passion that can't be controlled. Well, that's not true. And we all know, and you've heard before, that rape is about power and control. If a victim of sexual assault doesn't fight back, they must have thought, well, that wasn't so bad. Or maybe I wanted it after all. Well, that's not the case. A lot of victims lie about being raped or give false report. We've already established that that is not the case. And a person cannot sexually assault their partner or spouse. Wrong. It is against the law to rape your wife or your girlfriend, and it is, in fact, a sexual assault. When a girl says no, she really means yes. That's an old one. Rape is usually violent and involves a stranger. We've already established that is not true. If you hadn't been drinking, you wouldn't have been raped. So don't go out, don't be with your friends, don't have a cocktail, because, you might get raped. Men can't be sexually assaulted. Oh, yes, they can, and we see it all the time in our practice. Being sexually assaulted by someone of the same gender can make a person gay or lesbian. I hope you all understand that is not the case. People with disabilities are at low risk for sexual assault. No, they are at high risk. And a victim has to talk to the police if she wants to receive care or a sexual assault kit. That is not the case either. VAWA, the Violence Against Women's Act, has stated federally that a victim, whether male or female, may have a sexual assault examination without speaking to law enforcement. That is their right. So what about your practice? So if you have a practice of 2,000 patients and 2/3 of those patients are women, that means that approximately 440 of them have been a victim of sexual assault within their life. So should you be aware of the long-term sequelae of a sexual assault? Sorry, got an itch. Which are similar to other traumatic events. And are you prepared to ask the questions and then appropriately respond to the answers? Keep in mind that it's not unusual for a child victim of sexual abuse to also be victimized as an adult. These people who grow up as victims of abuse, sexual abuse per se, or any other kind of abuse, are known to be continually victimized throughout their life. So the big question is, will you take the time to talk to these people? And do you have the time to talk to these people? Because it's not easy and it does take time. So let's look at some of the short and long-term effects of sexual assault. It's pretty easy to understand the short-term effects, which is what the sexual assault forensic nurse examiners are dealing with at the time of the exam. And that is an unplanned pregnancy. There are women who have been sexually assaulted who end up pregnant. These are women who do not seek medical care or do not speak of this event and end up pregnant. Sexually transmitted infections, of course, including HIV exposure. Now, the rate of HIV transmission in our state is very low, 0.03% currently, but it is a concern for victims of sexual assault. They may have received physical injuries, or they may have been strangled, which is kind of the thing these days. These people feel a huge amount of guilt and shame, and they blame themselves for what has happened. They will have flashbacks about what occurred and think to themselves, what could I have done differently? What didn't I do right? They isolate themselves and withdraw from their families and friends. Now, when you look at the long-term effects, these are the things that you in your practice may be challenged with. Depression, anxiety, hypervigilance, agoraphobia. This is, of course, linked to the guilt, shame, and self-blame. These people also have chronic abdominal pain. When I was working in the ER as an RN, I had a young woman that came into triage several times complaining of abdominal pain. We could never figure out what was going on with her. Despite numerous tests and assessments, everything was negative. Well, what we finally figured out was she was a victim of domestic violence, and she was hoping that someone would ask her the question. So headaches, body aches, insomnia, fatigue, dizziness, GI disturbances, sexual dysfunction, which is pretty logical, dissociation, self-harm, eating disorders, and panic attacks. We see this in our adolescent population and young adult population. Substance abuse, emotional disorders, and suicidal ideation. So when you look at these things and you try to consider what might be going on with your patient, please consider sexual assault. So, do we need to look at that as a differential? When you look at the long-term effects of sexual abuse and assault, some of those difficult to understand complaints may make more sense if we consider a sexual assault or sexual victimization in our patient's past. Finding the root cause of pathology is sometimes very difficult to your patient's chronic complaints, but it may be a result of past sexual trauma. So if nothing more, I think we have to consider it when we're looking at our patients' histories and looking at social history and medical history and what they're there visiting with us today about. We have to consider sexual assault and be brave enough to ask. Okay, so how does this affect our patient care? If your patient informs you that they've been sexually victimized at any point during their visit, first of all, thank them for having the courage to tell you. This information will help you make better decisions, and you need to tell them that in order for you to establish what's going on with their health care and for you to be able to provide those best decisions, that information helps you. And nobody wants to talk about sexual assault. Victims don't want to disclose this. It's embarrassing, it's humiliating, and it's disturbing to them. And really, nobody wants to acknowledge that it's happening at all. But we've already established that it's happening a lot. So whether these things took place 40 years ago or just 2 weeks ago, disclosure requires courage and the feeling of being in a safe place. Now, if this is a long-term patient of yours, then they feel safe in your care and in your practice. But if this is a new patient, we have to work really hard to let them know that they are accepted and that what they are telling you is okay. So every time a patient discusses these events, it puts them right back in the experience. And who wants to be there? Not them. So what exactly are our responsibilities? In other words, so now what? We've got to listen and acknowledge them. And as I said before, thank them for having the courage to tell you. You've got to look at the time frame. When did this assault or abuse occur? And was there anal or genital penetration? This makes your decision making different. If this was a long time ago, and even if there was anal or genital penetration, your care will be different than if this happened 3 days ago. You may be, as we said, the first point of contact for these people. And our decisions about how to help them are going to be different depending on the time frame and depending on the act. If this was recent, within 6 days, then you're going to want to contact your local sexual assault nursing team. Because what do we want to be providing? Care, documentation, and evidence collection. So these examinations can be done up to 6 days from the assault. Now, it used to be 3 days, 72 hours. But with the advancement in forensic science, some teams are going out 10 days because they have found that we are able to collect foreign DNA up to 10 days out. The state of Utah is currently collecting at 6 days, as are most of the Intermountain region. We're going to provide support to these people and assure them that all this forensic care, if it is appropriate for them, is provided free of charge. That is also the law. People are not required to pay for anything that has to do with a forensic examination in this state. All right, so if the assault was over 6 days, we have to consider infections and pregnancy. So you look at, is it within the time frame to check for these sexually transmitted infections, and the time frame for pregnancy also. So once you've established their physical health is taken care of, then we have got to think about their emotional, psychological health, which may be what is impacting their symptomology that has brought them to your clinic. So think about contacting the local rape crisis center, and there's one in most communities. Group therapy, there are state resources for victims of crimes with regard to counseling, housing, safety, all of those things. And so the local rape crisis centers know all about that. Do they need an order of protection from the courts? The rape crisis centers can do that for them and help them with regard to any investigation and prosecution that may be going forward. So let's look at this and then consider what's going on with these continued and chronic complaints. Does this history of sexual assault, is it impacting their current health issues. So what are your legal responsibilities? If you live outside the state of Utah or your practice is outside the state of Utah, please investigate this because everybody's a little different. And in Utah, the laws change about every 18 months. So be careful about what is going on in your state and what the laws dictate for healthcare providers. Now, in our state, all the citizens within our state are mandated to report any crime against a child. So that's anyone under the age of 18 or a vulnerable adult. And here's your reference. If you look at an intellectually challenged, physically challenged, mentally ill, homeless, those high-risk populations we talked about, we are required, just as citizens of this state, to report to law enforcement or the appropriate agency. Now, as healthcare providers, we're mandated to report any suspected crime against a citizen of Utah. So I'm talking domestic violence, sexual violence, any, financial abuse of an elder. So any crime that we feel is happening, we are mandated to report. Now, who do we report to? Law enforcement, Adult Protective Services, or the Division of Child and Family Services. Those three entities cover your responsibility by law for your patients. So, if you are in a time frame where a forensic nursing team can help you, first of all, any forensic nursing team across the nation, if you have a question or a concern, welcome your calls for consultation. If you don't quite know what to do, you're looking at time frames. Here's an example. Say you have an adolescent patient and she's 14, 15. She's been on the run for the last week. She comes to your office after she returns home or after she has been taken home, and she discloses she has been sexually assaulted by numerous individuals over numerous days. Now, she's been on the run for 10 days. Is it appropriate for her to have a sexual assault examination? Absolutely. And these are things that your forensic nursing team can help you with. The other thing that the forensic nursing team will do is they will deal with law enforcement and reporting agencies. You don't have to do that. If you are in a situation where a forensic team, the nursing team, you need consultation or advice or direction, they will report to law enforcement. You don't have to do that. And sometimes that's really a stickler for a lot of people. They don't want to talk to the cops. They don't have time. They don't want to deal with DCFS. So your forensic team will do that for you. They will also get an advocate involved. So the Rape Crisis Center piece is taken care of. The examination includes a general medical history, a detailed history of the event, of what happened when, by whom, a full physical assessment with a detailed anal genital examination. All of these exams are diagrammed and photographed for any signs of injury sustained during the assault. Sometimes patients don't even know they've got abrasions on their backs or bruises on their mons pubis or bruises on their arms from being held. And we look at them head to toe and establish when did these things happen, if they know, but we document everything. Of course, evidence collection, and this includes toxicology if we are concerned about a drug-facilitated sexual assault, which we see quite often. We do STI and pregnancy prophylaxis, and we provide medications for gonorrhea, chlamydia, trichomoniasis, and HIV if necessary, and also pregnancy prophylaxis. We do detailed documentation of everything that's happened from the time we get the referral from your office, from law enforcement, from the ER, from whomever, and we collaborate that information with the investigators and the prosecutors. These patients are all referred for follow-up care with their primary care provider, which may be you, and any forensic care that's necessary. we refer for that as well. So what's available to you? You need to be aware of who the sexual assault team in your community is. If you're within Utah, the Northern Utah Sexual Assault Forensic Examiners, which is a mouthful, New Safe, we cover Weber, Morgan, Davis, and Box Elder counties. Wasatch Forensic Nurses, they cover Salt Lake County, Utah, Wasatch, and Summit. Cache County covers Logan, Cache County area. Southwest Forensics cover Washington and Iron counties. There are teams all over the state. We should be very proud in the state of Utah that we are able to provide care to patients all over the state of Utah, which we have some very rural areas that are out in the middle of nowhere. So if you can't find who you need, you call the National Sexual Assault Hotline, which is this RAIN organization. You can also get online and find out who can help you in your area. So please reach out. So in conclusion, I just want to tell you that you should all know that sexual assault can happen to anyone. It can be your daughter, can be your mother, can be your uncle. It can be anyone. And this consent that we all need to be aware of is an ongoing mutual agreement between the two parties. So when we talk about, oh, a husband can't rape his wife, yes, he can. So this mutual agreement has to go on from the beginning to the end of the sexual experience. So it can include a wide range of things, anywhere from fondling to a violent rape. As we established at the very beginning, there are many ways of being sexually assaulted. We have to consider that it can be prevented. And I tell all of my adolescent patients, you have to listen to your gut. If you find that you are uncomfortable in a situation, you're fearful of where you are, you have a right to be fearful. Listen to your intuition. And also know that support is available. You have support from forensic nursing teams, from rape crisis centers, nationally and locally. So please reach out. I thank you so much for attending today, and thanks to Brian Campbell and Teresa from the Ogden Surgical Medical Society for allowing me to speak to you today. If you have any questions, I happen to be in Portugal right now, but if you'd let Dr. Campbell or Teresa know, I would be happy to reach out to you when I return. Thank you so much for your attention, and have a wonderful day.